Breaking news: E. coli outbreak hits McDonald's. This just in: America's favorite fast food chain, McDonald's, is facing a major health scare. An E. coli outbreak has been linked to their food, causing widespread concern among customers and health officials alike. Multiple states have reported cases of E. coli poisoning linked to contaminated food. The outbreak has spread rapidly, affecting numerous locations across the country. The culprit? It appears to be the iconic Quarter Pounder. This beloved menu item is now at the center of a major investigation. This isn't just another food safety blip, it's a serious situation that has health officials scrambling and the public on high alert. The sight of health officials in hazmat suits at various McDonald's locations has only heightened the sense of urgency. We're here to break down everything we know so far. Our team of journalists has been working tirelessly to gather the latest information and provide you with a comprehensive overview of the situation. From the initial reports to the ongoing investigation, we'll delve into the details of this alarming outbreak. Health department officials are currently examining food samples to pinpoint the exact source of contamination. We'll examine the potential sources of contamination, including the meat processing plants and the supply chain for fresh produce like lettuce. These are critical points in the food production process where contamination can occur. The symptoms to watch out for, such as severe stomach cramps, diarrhea, and vomiting. It's important to recognize these symptoms early and seek medical attention if you suspect E. coli poisoning. And what McDonald's is doing to address the issue. The company has already issued a statement and is taking steps to ensure the safety of their customers, including deep cleaning their kitchens and conducting thorough inspections. Most importantly, we'll provide you with expert advice on how to protect yourself and your loved ones. Simple measures like washing your hands thoroughly and cooking meat to the proper temperature can significantly reduce the risk of E. coli infection. Stay tuned as we unravel this developing story and provide you with the information you need to stay safe. Our coverage will continue to bring you the latest updates and expert insights. This outbreak is a stark reminder that even in today's world, foodborne illnesses remain a serious threat. Hospitals are already seeing an influx of patients, and healthcare workers are taking extra precautions to prevent the spread of the infection. We'll explore the factors contributing to the rise of these outbreaks, including the conditions in factory farming and the complexities of the global food supply chain. These factors can create an environment where bacteria like E. coli can thrive, and discuss what needs to change to prevent future incidents. This includes stricter food safety regulations, better oversight of food production facilities, and more robust public health policies. This is a developing story, and we'll continue to update you as more information becomes available. Stay with us for the latest news and expert analysis on this critical issue. The Quarter Pounder problem: what we know so far. The alarm bells started ringing in early October 2024. It was a time of heightened concern as reports began to trickle in from various parts of the country. Reports of E. coli infections began surfacing across several states. Hospitals were quickly filling up with patients exhibiting severe symptoms, and the medical community was on high alert. What initially seemed like isolated incidents quickly revealed a disturbing pattern. A significant number of those infected had recently consumed McDonald's Quarter Pounders. This revelation sent shockwaves through the fast food industry and raised serious questions about food safety standards. The Centers for Disease Control and Prevention, or CDC, swung into action. Their mission was clear: identify the source of the outbreak and prevent further cases. They launched a full-scale investigation to determine the source of the outbreak and contain its spread. Teams of investigators and scientists worked around the clock, analyzing samples and tracing the supply chain. As the investigation progressed, the evidence pointing towards McDonald's became impossible to ignore. The data was compelling, and the link between the Quarter Pounders and the E. coli cases grew stronger with each passing day. The CDC released a preliminary report confirming the link between the E. coli outbreak and McDonald's Quarter Pounders. This report was a significant development as it provided a clearer picture of the situation and guided further actions. While the exact ingredient responsible for the contamination remains unidentified, the CDC narrowed it down to two potential culprits: the slivered onions or the beef patties. This uncertainty added to the urgency of the investigation. McDonald's, facing mounting pressure and public scrutiny, issued a statement acknowledging the outbreak. They were in a difficult position. balancing public relations with the need to address the health crisis. They expressed concern for those affected and pledged full cooperation with the ongoing investigation. McDonald's emphasized their commitment to food safety and the well-being of their customers. However, they stopped short of admitting any wrongdoing or issuing a product recall. This cautious approach left many questions unanswered and fueled public debate about corporate responsibility and transparency in times of crisis. Inside the investigation, tracing the source of the outbreak. The hunt is on for the source of the E. coli contamination. This is a race against time, as every moment counts in preventing further spread. Investigators from the CDC are working tirelessly. Their dedication is unwavering as they delve into the intricate details of the outbreak. They are retracing the supply chain of McDonald's ingredients. This involves a meticulous examination of every step, from the farm to the restaurant. Their goal is to pinpoint the exact point where the contamination occurred. This requires a deep dive into the logistics and handling processes. Two primary suspects have emerged: the slivered onions and the beef patties. These ingredients are under intense scrutiny. Both are key components of the Quarter Pounder. This popular menu item is now at the center of the investigation. Investigators are meticulously analyzing samples from McDonald's restaurants and suppliers. Each sample could hold the key to solving the mystery. They are examining everything from the farms where the onions are grown to the processing plants where the beef is handled. This comprehensive approach ensures no stone is left unturned. The investigation extends beyond the ingredients themselves. It also looks at the entire food handling process. The CDC is also looking at McDonald's food handling and preparation practices. This includes how the food is stored, cooked, and served. Could there have been cross-contamination during the cooking or assembly process? This is a critical question that needs to be answered. These are critical questions that the investigation aims to answer. The team is leaving no possibility unexplored. The investigation is complex and multifaceted. It requires the collaboration of experts from various fields. It involves experts from various fields, including epidemiologists, food safety specialists, and microbiologists. Each expert brings a unique perspective to the table. The pressure is on to find the source of the contamination quickly. Time is of the essence, and the stakes are incredibly high. This will help prevent further cases and ensure the safety of the public. The ultimate goal is to restore confidence in the food supply and protect public health. The team is committed to uncovering the truth. Every piece of data is carefully reviewed and analyzed. Public health workers are also playing a crucial role. They are educating the community and providing updates on the investigation. The scientific community is watching closely. The findings of this investigation could have far-reaching implications for food safety protocols. The use of advanced technology and protective measures is essential. This ensures the accuracy and safety of the investigation. Every small breakthrough is a step closer to solving the mystery. The team's hard work and dedication are starting to pay off. The public is eagerly awaiting answers. News reports keep everyone informed about the progress of the investigation. The investigation continues to evolve. New leads and information are constantly being uncovered. The collaboration and communication among the team are vital. Sharing findings and insights helps to piece together the puzzle. The community's health and safety remain the top priority. Public health officials are working tirelessly to ensure everyone is informed and protected. The data analysis is ongoing. Each new piece of information brings the team closer to identifying the source of the outbreak. The scientific rigor and dedication of the team are commendable. Their efforts are crucial in solving this complex case. The investigation's findings will guide future safety measures. Ensuring that such an outbreak does not happen again is the ultimate goal. The team's commitment is unwavering. They are determined to find the source and protect public health. The community's support and gratitude are heartening. Together we can overcome this challenge and ensure a safer future for all. E. coli 101. Understanding the threat and its symptoms. E. coli, short for Escherichia coli, is a type of bacteria that normally lives in the intestines of humans and animals. While most strains of E. coli are harmless, some can cause severe illness. The strain responsible for the current outbreak is particularly dangerous. This strain produces a toxin that can cause a range of symptoms, from mild diarrhea to life-threatening complications. Symptoms typically appear within 3 to 4 days of consuming contaminated food and can last for up to a week. Common symptoms of an E. coli infection include stomach cramps, diarrhea, often bloody, vomiting, fatigue, and fever. In severe cases, E. coli infection can lead to dehydration, kidney failure, and hemolytic uremic syndrome, or HUS, a serious condition that affects the blood and kidneys. Foodborne illnesses on the rise. Are we facing a growing danger? The recent E. coli outbreak linked to McDonald's is a stark reminder of a disturbing trend. Foodborne illnesses are on the rise. According to the CDC, an estimated 48 million Americans get sick from foodborne illnesses each year. But why are these outbreaks becoming more common? Several factors contribute to this alarming trend. First, industrialized food production. Our food system is increasingly complex, with ingredients traveling long distances and passing through multiple handlers before reaching our plates. This creates more opportunities for contamination. Second, climate change. Changes in temperature and precipitation patterns can create more favorable conditions for the growth of harmful bacteria. And third, antibiotic resistance. The overuse of antibiotics in agriculture is contributing to the emergence of antibiotic-resistant bacteria, making infections harder to treat.